Okay, so my project, my senior honors project that I chose to do was to look at the advantages and deficits of being a bilingual speech language pathologist. Because being a communications disorder, my career goal is to be a speech language pathologist and help those who have speech and language impairments. And so, one of the first things I want to address is I think it's going to click. Okay, there you go. Communication is a huge component of communities, industries, and society. Without communication, we would not be able to converse with one another to share ideas, thoughts, conversations, expressions, and those kinds of things. But to understand how communication works, though, the communication works through a communication module, which includes the sender, the receiver, and the message. Senders will typically send their messages in four different forms of communication, being verbal, nonverbal, written, or visual communication. The receiver would then interpret this communication, provide feedback if there is any concerns or clarification that's required. And then once that conversation has been established, communication can move freely. However, it's kind of hard to do when you have the US containing 350 languages. And so when you have someone who's trying to speak English speaking to someone who only speaks Spanish, there's going to be that language barrier, which makes conversations exceptionally hard. And so you would think it's easy. Get a bilingual translator to interpret both sides. But that translator can only be so effective if they are at a native level proficiency. And so, according to the Commission on Language Learning in 2016, they found that more than 45% of immigrants who arrived as children under the age of 13 actually lose that literacy level. And as a result of that, they can only speak and understand their native tongue, which, if you think about it, that means that as the generations progress, by the third generation, only 1 out of 10 individuals can speak their native tongue at an advanced or native level. And that can be really concerning, especially with documentation being such an important thing right now in this time and era. Without documentation or proof or understanding what the fine print says, that can lead to a lot of red lines. And so if you're going to apply that 1 out of 10 statistic and apply it to the Los Angeles population in 2005, 2 million of those people live in that area. And out of the 1 in 10 of them, only 200,000 of them would be bilingual enough in their native languages that they can give correct interpretations and translations. And so if you really think about it, if someone's needing a translator, it's like finding a needle in a haystack. It's so limited, and the availability and access to it is extremely difficult. And you would think, why is this important? Well, if you are like me and will one day work for ASHA, which is the American Speech Hearing Language Hearing Association, they require people who identify as bilingual to be advanced in the 5 areas of language, which includes vocabulary, semantics, grammar, pronunciation, and pragmatics. So just because you took high school level Spanish does not equate to you being bilingual because you're going to have to perform a lot of these assessments and protocols and meetings in that second language. And if you are not advanced enough, there's a possibility that you might be producing more harm than you are doing good. And with that being said, the challenges that come with that is ASHA is so specific. A lot of these clinicians don't want to identify themselves as bilingual just in case they run into that red tape. And as a result, 93.46% of us consider ourselves as monolingual speakers. But the communities that we typically serve are minority groups like African American, Mexican American, Asian American. And so, do our clinicians reflect the clients that we serve? Why is it so whitewashed? Because 92.10% of us are white. Nothing against you guys. It's just the number's kind of jarring, considering you would think that inclusion and diversity would be a lot more prominent in this day and age. And so the research that I performed was a pilot study that reviewed 15 bilingual SLPs and 15 monolingual SLPs to see what their opinions are in regards to bilingualism. And so I sent out an anonymous Qualtrics survey that asked these 5 different questions just to understand what the population is like in LA and Orange County, as well as looking at the pros and cons of being a bilingual speaker in the speech pathology field. And what I found was that a lot of us predominantly speak Spanish, but that's reflective of the LA population because, as you saw earlier, About about 1/3 of us are predominantly Spanish speakers. And so, being that there are 15 bilingual SLPs, six of them were Spanish speaking, it reflects that. But the thing that caught me off guard is the fact that a lot of these bilingual speakers typically use their second language on a weekly basis, which means that on a weekly basis, they're interacting with someone of their same background who requires additional assistance to understand the information in their main language. And just to disclose, there are areas that say NA, but that doesn't necessarily mean that it's zero. It's more that just the clinician didn't say when I gave the anonymous survey, and because it was anonymous, I couldn't follow up with them. And the next result that I found was pros and cons of being bilingual in the practice. As you can see, the pros definitely outweigh the cons, being that one, you have cultural competency, you don't need to find additional interpreters, nor do you have to train more people when you're giving out protocols and assessments for these different tests that we give. On top of that, we're able to switch languages during therapy sessions. And so if you have a child who speaks predominantly Spanish who doesn't understand English or has limited English, you're able to code switch very quickly so that they can correlate the languages a lot easier to understand the vocabulary. And last but not least, the main one that a lot of these SLPs talked about was the direct line of communication to their patients. Because instead of having an interpreter to translate the messages, they can tell the patient exactly what they need to hear and what is being required of that patient, and so on and so forth. And as a result, parents feel a lot more comfortable and are willing to be more forward in regards to what they demand of their clinical services and the kind of care that they're looking for, instead of being filtered by some translator and potentially losing important information. And then the cons of it, though, the surprising part was that we get racially profiled the moment we walk into any of these rooms. Clients have the option to turn away services if they do not see us fit to serve them. But that's the typical case when you have like doctors and businesses. That's just what it is. But that was shockingly jarring because you would think bilingualism is all great, but really it's a double-edged sword. And on top of that, a lot of bilingual speakers tend to have major burnout because not only are we trying to serve our group in caseload, which can range between 19 to 80 caseloads in a whole entire year, we're also trying to help other people who are seeking that translator because one, they can't find it, two, you're in a tight time frame, or three, you just don't have access to someone who speaks that specific language. And so at the end of the study, it made me realize that Orange County and LA, we have predominantly monolingual English speakers. And for me to actively try to seek out bilingual speakers, instead of only taking me 2 weeks, it took me essentially about 4 months, 4 to 5, because we were just so limited. And it was insane because I didn't think that was possible, but it makes me also realize that clients also face that same struggle that I was facing. And for them, they're in more of desperate need because they need the services, they need the help. And as a speech language pathologist, we can provide services to bilingual clients based on their level of proficiency in their first and second languages. If they have very limited English, it might be best to refer them out to somebody who speaks the language that they're the strongest in. And on top of that, bilingual clinicians are so limited. It's sometimes so limited, kind of impossible in regards to finding a clinician who can serve this specific person. And at the end of it, according to our code of ethics, audiologists and SOPs, we are obligated to provide a culturally and linguistically appropriate services. And through that, we need the proper professionals to execute this in order to include a diverse community that helps the people in our field. And so bilingualism is important. It's key. And we just need to pay more attention to it. And so a little thanks to everybody who's been part of this, ABC School District, Professor Chakraborty for being my mentor, and Dr. Sandra Perez for just giving me this opportunity. I really appreciate it. And so, yeah, that's about it.